Then I also got this question. Should is the most expensive surgeon the best surgeon or not? Over to you. Over
You
to
guys
you.
want to get me in trouble, huh?
These are no honestly, these are questions that people were asking.
Yeah.
Yeah.
Um, I'll answer it like this.
Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to enable you to make an informed decision. So today I have a guest with me, and I'll just let him introduce himself before we carry on with the normal flow of the episode. So over to you, Dr. JP.
Sure thing. I'm Dr. JP Ogalo, board certified plastic surgeon, here to give you a little tiny dose of health.
Yeah. You tried, you tried. Karibu
Hopefully
sana.
it works. I don't know.
No, you have to take one thing. If not everything, at least one thing.
Uh-huh.
So I don't know about you, but I'm feeling so this is one day after a public holiday and it kind of feels like a Monday.
Mhm.
Is that the same for you?
No, every day is just a work day, kind of for me these
Hey,
days.
we need to change that.
The
Even
holidays,
Sunday.
weekends, they all look the same.
So when do you give yourselves breaks?
You find pockets.
Okay.
You find pockets.
Yeah.
Yeah. A lot of the time, I only find it easier to get a break when I actually like leave town.
Mm.
Yeah.
And is that for work or for pleasure?
For pleasure. Like it has
Okay.
to be like targeted. I need to get out of this town for it to be like a
Mm.
proper break.
Sounds like
So that my
internship.
response to every phone call is I'm not in town next week.
Ah, yeah.
Right?
Okay.
But if I'm in town, then there's always that, guilt, duty of care
Yeah.
and
Just
service.
like, okay, fine,
Doctors
okay,
have,
fine. I'm not
okay,
too
fine,
far.
I'll squeeze in an hour today. Let me come
Yeah.
see you. Let me rush. Let me do this
Mm-hmm.
kind of thing. Yeah.
Okay. So we usually do this thing where we take a journey to Inside Out. I don't know if you've watched Inside Out, the movie.
Inside Out.
Yes.
No, I haven't.
Why has no one watched Inside Out? This is now getting interesting. So that's homework. Go and watch Inside Out. It's a
Okay.
really nice movie. It explains about emotions and why we are the way we are in terms of our emotions. So I
Okay.
just want to find
I'm
out.
very good at emotions.
Oh, lovely. So
No, I'm
where are
not.
you emotionally as of now? Just maybe one
Where am I
emotion or two.
emotionally as of
Yeah.
now? I am in a place of extreme gratitude.
Oh.
But gratitude is not an emotion. What am I trying to describe? It's kind of a mix between euphoria and peace and love and all these
Oh,
things.
peace. I love that.
Just being able to sit back and look at what I've been blessed with so far, especially let me not even just say like this last year, but my entire life.
Okay.
Yeah.
Hey, you've
And
been
just
doing
say
some
that,
introspection, some
yeah,
reflection.
it's important sometimes
Yeah.
to take stock.
That's true. And now it's the end of the year. So we're shooting
it's the
this
end of the year.
December. It'll go
Yeah.
out like next year. But yeah, taking
Yeah.
stock is very important.
And it helps keep me grounded
Well, that's true.
for the most part.
Sawa,
So that's
sawa.
where I am emotionally.
Peace. I think peace is
Yeah.
something everyone is looking for. So now that you're there,
Yeah.
kudos to you.
Thank
Wengine
you.
wetu tutafika. Then something else you like doing for the audience. So people tend to think that as doctors, we use too much medical jargon. We try and, overcomplicate things. So is there one medical jargon that you want to debunk for my audience?
One medical jargon that I
Yeah.
want to debunk for the audience. Let me see.
It doesn't have to be from your field.
It doesn't have to be
No,
from
no,
my
no, no.
field.
It doesn't have to.
It has to come from my field.
Okay, that's fine. Challenge accepted.
It has to come from my field. But I probably we're gonna get into this in the episode, but just what kind of plastic surgery is, and what it's not.
Okay.
Yeah.
Yeah,
There's a
that's
huge
true.
assumption that plastic surgery is just cosmetic. It's just boob jobs, butt
Yeah.
lifts, and all that kind
Yeah,
of stuff.
and
But
Botox.
it's
Yeah.
it's a lot wider, and there's a lot of good stuff that we actually do, you guys.
Contrary to popular
Bring
belief.
actual change and impact
Yeah.
within plastic surgery. So I'd love to debunk that.
Okay. Okay. So now that we're actually going
Strip
there.
away what plastic surgery actually is.
So I asked my community what questions they'd like to know or are concerned about when it comes to plastic surgery.
Mm-hmm.
And just to kick off the episode, let me just start with the first one that shocked me.
Mm-hmm.
Someone was like, do we even have any credible plastic surgeons in this country?
Mm-hmm.
So, first of all, here is one of them, and you're going to elaborate more on that.
Yeah.
But I'd like you to tell us now, as you mentioned, plastic surgery is not just about cosmetic.
Mm-hmm.
What is plastic surgery, if you can break it down for us? Because, of course, there's its importance in even curative medicine.
Mm-hmm.
So, just break it down for us a bit.
Okay, so plastic surgery, the actual full title of the degree is plastic reconstructive and aesthetic surgery.
Okay.
The problem is that's a huge mouthful, so we just shorten it to
Like
plastic surgery.
MBCHB.
Yeah, just a doctor, like don't complicate it. So plastic surgery is pretty similar. So it essentially has two disciplines within it, which is the reconstructive surgery, and then there's the aesthetic surgery or cosmetic surgery.
Okay.
So that whole umbrella is called plastic surgery. So as the name suggests, reconstructive surgery is more dealing with returning form and function. So if you've been in an accident and you've scarred your face or badly injured any part of your flesh, then you get plastic surgery to reconstruct whatever has been damaged. Or even congenital things like cleft lip, cleft palate, that falls under plastic surgery. And then have the cosmetic surgery, which is the BBLs of this world, the breast lifts, the tummy tucks, the lipo, all that stuff.
Okay.
Yeah, it's a fairly, let me say, young discipline relatively in the country. So, I mean, this is going back to kind of the question that you were being asked about, are there qualified plastic surgeons in the country? Just to give you a brief history lesson. Okay. History.
I'm listening.
The first plastic surgeons in this country probably was in the 80s.
Okay.
All right. The 80s. There were not many. I think they started off as one. And then in the 90s, we got a few more coming over. There's a gentleman who came over from Egypt. Then we had a few Kenyans. By then we didn't have the master's program for plastic surgery here in the
Okay, so you had to
country.
go abroad.
Yeah, so you had to go abroad. So
Okay.
there's a bunch of general surgeons who did general surgery and then went to different places to do plastic surgery, like India, South Africa, some parts of Europe. So then they then came back. And then we only started training plastic surgeons in the country in 2013.
When I started med school.
Wait, whoa.
First of all,
when
you
you
know, we're
started
in the
med
same
school?
anatomy class.
Oh, really?
Yeah, you were near the door, I remember.
Yeah.
Me, I was at the back.
Yeah, I hope you
we're in the
weren't
same
on my
anatomy
table.
class. No, I wasn't on your table. You were on my friend's table,
Okay,
actually.
thank
Yeah.
God for that. I was horrible at anatomy.
I think we all were.
I would have
we were
led you down a
trying.
very dangerous path to failure.
So you were the first class.
Yeah, it was the
Okay.
first class. It
Okay.
was the first class. So before that class of mine for 2013, there were probably around 7 plastic surgeons in the country. Or none of them trained locally.
Okay.
All right. So then now from 2013, now when we started training plastic surgeons locally, we started churning out a lot more.
Yeah.
Yeah, it's the beauty of local manufacturing. that the
Hey,
government
but
is
we needed
supposed
it.
to
There
be
was a
doing.
gap, and at least there was a gap, and now you guys are, you're filling in that gap.
Yeah. So
Okay.
kind of now we're filling that gap. So right now, as we sit here today, there's probably around 30. I think the number is 32
Okay.
qualified and board certified plastic surgeons in the country,
Wow.
and there's probably another 20 to 30 in the pipeline
Okay.
currently in school.
So in the next 5 years, you should be around 50.
Yeah,
Okay, that's
we
great.
should be.
So how do you become certified? Like, what's the process? How long is plastic surgery as a master's program? Do you need anything else apart from that to now become a certified plastic surgeon?
Okay, so you do your well, let me say I did. I know things have changed now. So
yeah.
5 years of undergraduate studies.
Okay, yeah.
Right. I think it's now, is it 6?
It's 6.
Yeah. So
It's
5
6
years.
plus more with the strikes and etc.
Yeah, so I did 5 years undergraduate, and then you kind of disappear for an internship and a bit of life, and then come back, and then you do another 5 years in your master's program.
Okay.
Yeah, 5 years is the prescribed time. I did it in 6 years.
Okay.
Myself, so that's a total of 11 years. And then after that, you have to get this thing called specialist recognition. So even after you've graduated with your master's, I'm sorry, this thing it doesn't make sense to me. But anyway, I graduate with your master's. like you feel fully qualified
Yeah.
academically.
Okay.
All right. But
Yeah.
the medical council requires you to do this 2 years of specialist recognition. All right. So you work for those 2 years, and then after those 2 years, they give you a specialist recognition certificate.
Okay.
Yeah.
And that's across every master's program, right?
Yeah.
Okay. So now you've mentioned that they are licensed and certified plastic surgeons. Where can we find them? Like, for instance, yourself, where are they found? In like hospitals? Do you guys run your own clinics? Where do we find these plastic surgeons?
Okay, so I guess there are various levels to this. One of the easiest ways is if you go to any of the major hospitals, they, okay, for example, in the public system, a lot of hospitals these days have plastic surgeons. Okay, so if you go to somewhere like KNH, they have a whole plastic surgery department. If you go to MTRH, they have a whole plastic surgery department, and KU referral, they have a whole plastic surgery department. So the big hospitals have kind of done all the vetting for you. Okay, so those are legit, proper plastic surgeons.
Okay, I like the word legit.
Yeah. If you go to the private hospitals as well, so they have a lot of plastic surgeons who are on board as admitting doctors, admitting consultants.
Yes.
So if you go to Nairobi Hospital, they link you with a plastic surgeon. Aga Khan, they link you with a plastic surgeon.
Yeah.
So you can trust the big institutions to link you with one. Okay, I can't speak so much for not all the private hospitals, because a lot of things happen in this Nairobi, and people can pretend to be what they are not.
Okay, that's true.
And then there's obviously a bunch of plastic surgeons who opened up their own specialist practices. So that's another easy way to find them. And then again, I always tell my patients that if you also want to check the credentials, because sometimes when somebody is running a private practice, they can put their plastic surgery and all these things,
That's
but they're
true.
not actually plastic surgeons.
You might be a GP as well, for as much as we know.
Yeah, you kind of have to take their word for it.
Yeah.
But anyway, so you can go onto the medical council's website, and you can actually search the practitioner if you have their name, and it'll give you the list, the name of the practitioner, their medical council number, and what they actually specialize to do. I even have patients these days who call the medical council
Really?
just to find out if somebody is legit, and then now they come in for their consultation.
Okay, I like the fact that they're doing due diligence.
Or even the medical council sometimes can direct you to one.
Yeah.
Oh, there's also the Kenya Society of Plastic Reconstructive and Aesthetic Surgeons. So that's the professional body that is the umbrella body for all the plastic surgeons in the country. And they have listings for every single plastic surgeon in the country.
Okay.
Yeah, you can find them online. So you just give them a call, and then the secretary can direct you and tell you whether someone's legit or not.
I think that makes things so much easier. Okay, so the next question is now, because we have social media today, and so many people are saying bodies they want, or like your face, your nose. So you're influenced a lot by social media. Now, from a plastic surgeon's perspective, how do you guide patients to get or receive the treatment that they may want or need? And how do you manage the expectations? Because sometimes you might want this, but you also have to manage the patient's expectations that based on one, maybe your body type or the shape of your face, it might not look exactly like that. So how do you manage patients' expectations?
Okay, so like you said, some patients come in already with a preconceived idea of what it is that they want.
Do they come with like the phone? Like, I want this.
No, actually, I don't have. Not many patients actually come with their phone.
I like that. I like that.
So I prefer to focus on what the problem is rather than what the solution they want is, okay? Because you have to be addressing the problem.
Yeah.
Okay. The solution to addressing that problem is a totally different issue. So you sit down, and the first thing is, okay, what is your problem? Like what is it that you don't like, and what exactly it is about it that you don't like? And then we create not create the solution, but curate the solution based on what the problem is. I say this because, for example, I always give this example that a lot of patients come in wanting liposuction.
Okay.
Because they've seen it, they've heard about it, all these things, but the solution for them might not necessarily be liposuction, or liposuction will not going to give them the results that they want.
Yeah.
Okay, so that's why they come in for the consultation, so that I can advise them professionally as to what would give them the best kind of results. Okay, even if it's liposuction, is it liposuction plus something else, and that kind of thing. So I prefer to focus on what the problem is and how I can address it, and then not only just how I can address it, but how much can we address it.
Exactly. Yeah, that's so important.
So to manage the expectations,
Yeah.
okay, which is very important. You can't promise people the world. okay, and not be able to deliver it. So you have to
That's
have a
true.
very honest conversation. Like, look, we can do this, but we're only going to get so far with this. Okay, and is that something that you're willing to accept? If the answer is no, I still want this, then
Yeah.
you're like, okay, I can't deliver that for you.
Okay.
Okay, so
Yeah.
I can get you this far. If you want this, that's fine. If you want to get to somewhere that's not reasonable, then I'm probably the wrong person for you.
You've answered my next question. I was going
Yeah.
to ask, is there any time you say no?
Yeah. There are times when usually before I say no, I would really, if it's not an outrightly ridiculous request, like I want to look like a cat, or
Like, give me some whiskers, please.
those ones off the bat you say no.
Yeah.
But if it's something that I mean is within the realm of what's normal, but maybe just very, very difficult to achieve,
Yeah.
then I'll probably sit with it a bit and try and think, okay, how can we actually get this done? I don't just say no because I don't want to.
Yeah.
Okay.
Yeah.
I have to be able to have a reason and look at you and say, okay, no, I don't think we can do this because of A, B, C, D. It's not worth the risk. I don't think you're going to get the outcome that you want. But also, again, you have to also balance with the expectations of the patient. And if the patient is like, okay, listen, I only want to improve this much. I'm not looking for
Like perfection.
perfection.
Yeah.
Then if you can meet somewhere
In the
in the
middle.
middle,
Yeah.
and the patient understands the risks, the complications, and what you can actually achieve, then you go ahead with it.
Okay.
Or again, if it's something that's also, because again within plastic surgery there are things that can tend to also be super specialized as well. So
Oh.
if there's somebody else in the field who is better at a certain thing than I am, then I would say, okay, look, I understand you probably want me as your doctor, but
Yeah.
there's somebody who's a bit better at me than doing this. Can I send them to you?
Yeah.
And if they insist that no, I want you to do it, then okay, fine. But if I can find somebody better to do it, then you
Okay.
pass them off to the next person.
I think fair enough. Like, it's just the referral process. Yeah. Then you've mentioned risks. So I got another question where someone was asking, why do we say that some of these procedures are very dangerous? So when it comes to plastic surgery, what are some of the risks that you communicate to your patients or that people need to know about some of these procedures? And I know now we are slightly focusing on the aesthetic side. I know for the reconstructive side, it's more of a need.
Yeah.
So for someone who wants a cosmetic procedure, what are some of the risks that you let them know beforehand?
Okay. I think plastic surgery has had some very bad PR around it. I think
Because
historically.
yes, yeah. But we're here to correct that.
Yeah, we had to correct that because things like patients saying that plastic surgery is very risky.
Yeah.
Like based on what because look, there are tons of patients who get plastic surgery every single day.
Yeah.
The unfortunate bit about it is it's only the ones where a complication has developed, for example, that actually make the press.
The headlines, yeah.
And it gives everything bad press. Okay. But by far, a majority of all the procedures we do were done safely and with good outcomes.
Okay.
So it's kind of something that needs to be we need to sanitize it, Kidogo, and then, kind of clean it
Yeah.
up. And the funny thing is the patients who actually do get the good surgeries with no complications, they kind of don't want to talk about it. So you'll
And
never
they
know.
should. I think they're the ones who actually should be talking about it. Or
Yeah.
rather, from now, your perspective as the
Yeah.
doctor, to just shed a light on those positive experiences. Yeah.
They're like, no, Dr. I don't want anybody to know. This is our
'Cause,
secret.
all we see is, what are they called? The fahas, and with
Yeah.
blood everywhere. It looks scary. Like, even me as a medical
Yeah.
doctor, it kind of looks scary.
Yeah.
Yeah. So when it comes to now plastic surgery in Kenya, we all look at it as such an expensive process.
Yeah.
Do you guys take insurance? Is it strictly cash? Like, what's the payment process like?
If it's cosmetic surgery, it's cash.
Okay.
Insurance doesn't cover for cosmetic surgery. If it's reconstructive surgery, then there is a role for insurance to cover for that. Yeah.
Okay. What's the allowance? Like, why would an insurance allow for my reconstructive surgery? Like, what criteria do I need to meet?
I mean, like I mentioned earlier, you see, reconstructive surgery is all about function, form, this, that, and the other. So it also involves patients like cancer patients, patients who've been in accidents. So they are essentially covering for essential care.
Okay.
Okay, because you need this surgery in order for you to be able to make a recovery, as opposed to somebody who's coming in for a cosmetic procedure where they do not necessarily require this to live a normal functional life. Well, I myself have issues with that statement,
Yeah.
but because what a normal functional life is relative.
It's true.
Okay,
Yeah.
somebody who wakes up every morning and doesn't like the way they look is not able to live a normal functional life. So you could
And now that
argue
you've
that it is
alluded to that,
essential,
yeah,
for them to uplift their looks.
yeah. So now, because you've talked about that, for instance, a patient who has had a double mastectomy, they had breast cancer.
Yeah.
Would insurance cover reconstructive surgery for, like, if they want to get their breasts done?
It's a hit or miss for
Okay.
breast reconstruction. I'd say probably around 80% of the time they don't cover for that.
Okay.
Yeah, but NHIF
So
does. Well,
high.
NHIF,
Really?
SHA, it covers.
And Shashif and the likes.
Yeah, whatever it is, whatever is going on there. But a lot of the private insurers do not cover for breast reconstructive surgery,
Okay.
which is unfortunate.
Yeah.
Yeah, they consider that cosmetic. Yeah, so there's a lot of work we need to do in
That's so
terms of some
sad.
of these policies.
Yeah.
Yeah.
And now, because you've talked about how function can be relative, like how I feel comfortable living might be different than for you. Do you guys work together with like mental health professionals? Because I think there's a collaboration there that might need to happen if it's not already happening.
Yeah,
Yeah.
we do sometimes.
Okay.
Not as much as probably I would like.
Okay.
But we do, because sometimes we also, I mean, the reality of it is that a lot of people who are living with anxiety, depression, this, that, and the other. So inevitably, at some point, one of those kind of patients will walk into your office, wanting a cosmetic procedure. And you kind of need to be able to make sure that their request for a particular surgery is not a manifestation of their underlying mental illness. Because if it is, then you're not fixing the problem. You understand?
That's true.
So their problem may be related to their own issues around body dysmorphia or anxieties or depressions and that kind of thing.
Yeah.
But if that's not addressed, then, or at least if their mental health professional hasn't cleared them or given them a clean bill of health, then it's probably not a good idea to take them down that path.
Okay.
So I have had patients in the past who declared, like, listen, doc, I'm on treatment for A, B, C, D, but I still want to get the surgery done. I'm in a good place. I'm thinking very clearly about this thing.
Yeah.
So normally what I'll do, I'd send them back to their psychologist or psychiatrist, and they just to give me a note or give me a call and tell me that, okay, yeah, she's good.
Okay.
Yeah, they can have this procedure done.
I like the fact that you do that because I think it's very necessary, especially in the time we're living in.
Yeah.
Okay.
Unfortunately, also some patients don't declare.
But no, I have a question. If they don't declare, is it wrong on our part as the healthcare providers? Because you should pick that up in a comprehensive medical history.
Yeah.
Yeah. So is it our flaw or is it theirs?
A medical history is only as comprehensive as the patient wants it to be.
Okay.
All right. If I ask you to your face,
that's true.
Are you
the
suffering from bipolar disorder?
No, the famous question. Do you drink?
Exactly. You see, if they tell me no, then I have to kind of take it at face value.
No. Okay.
Right? And then just write it down in my notes.
Yeah.
Okay. Unfortunately, I can only go. There's no other way for me to. There's no website where I can go and
That's
Google
true. That's true. Okay.
That's true. Or chat GPT.
That's my patient. Now, are there any contraindications? And maybe that can be one of the words we decipher, contraindications in terms of or an eligibility criteria for plastic surgery. I know I'm generalizing, but some of these conditions, the criteria is the same, like some points. So tell us, if I'd like to have plastic surgery, is there a criteria that you'd have to go through? And what are some of the contraindications?
Okay. Let me speak about cosmetic surgery in this sense.
Yeah.
Because I feel like that's more where your question is leading towards. Generally in surgery, and especially in cosmetic surgery, we tend to be very protective of pregnant women and lactating mothers.
For sure.
Don't go anywhere.
Those are our babies, by the way.
Yeah. If they do come, it's like, you know what, it's okay.
Yeah.
Let's wait. Just finish that journey. Give yourself a year and come back. I'll still be here. So no, we don't tend to operate on those kind of patients. there are patients who can give you a lot of problems down the line. Patients who are excessive smokers.
I was waiting for that.
Yeah.
Please, every time I tell people, guys, vaping, smoking, stop. It's not good for us. And it literally affects every part of our body.
Yeah.
Yeah. And healing. Please explain to them the healing process and how it's affected by smoking.
Yeah, so I mean, cigarette smoke has a lot of nasty stuff that prevents healing to go along, a predictable path. And a lot of it has to do with the effects of what the cigarettes have on the blood vessels. Because healing and life at the end of the day is just a matter about how much blood is pumping through a particular area. So, for example, if you have patients who have done an entire tummy tuck, and they never told you that they are an excessive smoker, they end up getting the sense of the wound giving way. Just a lot of, in general, terrible wound healing issues, and also their recovery time tends to be a lot longer. They don't bounce back as fast. They are at a higher risk of getting clots in their legs and everything that comes with that. Diabetic patients are also can be a problem if it's not well managed, well controlled. Hypertensive patients.
This clearly shows that you just need what was the word we used to say? You need more than one player in terms of like medical providers.
Yeah.
What's that word we used to say?
Multidisciplinary
approach.
Yeah. And also there's obviously, of course, the extremes of age on this other side, especially for cosmetic surgery. You're not trying to do any cosmetic surgery on anybody who is below the age of 18.
Okay.
All right. Unless they've come in with a consenting adult who is their parent, preferably. All right. And even then, there are kind of some things you need to do just to make sure that these guys are making the right choice. And then again, also as a professional, you have the right to say that, I don't think we're going to do this. For example, it doesn't matter if, for me personally, for example, if I don't know, a 16-year-old girl was to come in with her parents and they were like, okay, we want her to get a breast augmentation, breast lift. Even if the parents are, consenting to it, I'll probably say, no, I don't think we need to do this.
Let me reverse that, because someone asked, what if they have gigantomastia?
Yeah.
Would you do a breast reduction?
Yeah, absolutely. That's a different scenario.
Okay.
Yeah, because we consider things like gigantomastia or having extremely excessively large breasts as a reconstructive thing.
Okay.
Yeah,
Okay.
because that one does have a significant direct impact on your quality of life.
Yeah.
And the patients tend to get very severe back pains, headaches, migraines, can be unbearable.
Okay.
Yeah.
And insurance would cover that?
Sometimes.
Okay. It depends on your insurance.
Depends on the insurance. Depends on the insurance.
Yeah. Okay. Then now, in this age of social media, would you say social media has had a positive or a negative impact on the field that is plastic surgery?
It has had, continues to have an impact on that.
Yeah.
And I wouldn't even say social media, even just media in general, because a lot of plastic surgery has been played out in the media, even from way back from the days of people like the Marilyn Monroes of this world, and what it looked like to be a beautiful Hollywood star.
Yeah.
All right. So a lot of those aesthetic representations of beauty have been transplanted into our society even today. So what tended to happen, if you're looking probably, let me not say more recently because I'll start showing my age. Recently in the 80s
Age
and the 90s.
is just a number, guys.
In the 80s and the 90s, there was that whole, having to look like a Barbie doll kind of thing, being slim, having the large breasts and, all these things. So plastic surgery during that period kind of emulated what was going on there. So a lot of people were getting things like breast implants and that kind of stuff. And right now we're seeing a kind of reversal of that because it's crazy. So what happened in the West is that a lot of people who are getting plastic surgery went with that trend for the very large breasts and the big bum and all that kind of stuff, because essentially people were trying to look different. All right, they didn't want to look like they call it like the plain Jane.
Okay.
So they wanted to look different.
Yeah.
But with the very high uptake of plastic surgery in the West, when everybody started getting their boobs done and their butts done, then all the women started kind of looking the same.
That's true.
Right? Everybody now had big boobs and a
I hear
large
that's
butt.
like in Turkey and the likes, like all women are now
Yeah.
looking the same.
Yeah. So now there's kind of a reversal because, like, okay, everybody looks like that. I don't want to look like that.
Mm-hmm.
So they're looking for something, but not as much.
Yeah.
Okay. So
Yeah.
we're in a situation right now where a lot of women are coming to have their implants removed,
Mm-hmm.
or when they're requesting a procedure, they don't want something that is excessive. They just want subtle, they want
Subtle.
natural looking kind of things.
Yeah.
So, which in my opinion is fantastic.
Yeah. I guess
Okay.
that's the essence. It's
That's
supposed
the
to
essence.
complement what you already have.
Yeah, and it's the kind of plastic surgery that I prefer to practice
Okay.
myself.
Yeah.
So it makes things easier in that sense. And then we also had a very interesting period um, during COVID,
Mm-hmm.
because during COVID, people were not interacting face to face
Yeah.
much, and a lot of people were on Zoom calls, and there were that's how the
Virtual.
interactions
Yeah.
were, and it made people a lot more conscious of how they looked, surprisingly. Yeah,
Oh.
because when you're on a video call, you have the screen, then there's the
Yeah.
small screen that shows your face, and then so you're having a meeting, but you're constantly looking at your face, and like you start realizing, oh, I don't like these wrinkles and this, that,
Yeah.
and the other. So a lot of
Okay.
people were coming in for non-surgical aesthetic treatments,
Mm-hmm.
so like Botox and filler and
Mm-hmm.
that kind of thing,
Yeah.
just to kind of literally make themselves look better on video calls.
That's
Okay,
interesting.
because that's what was happening, because that was the place where everybody was presenting themselves to the world.
Yeah.
It was no longer in the office,
Mm-hmm.
where you could potentially go with I guess more makeup on and that kind of thing. But if you're at
Yeah.
home and you're working from home,
Like it's
you
all I
could do
have.
minimalist makeup and then work with what you actually have
Yeah.
behind that. So that kind of changed things a little bit.
Mm-hmm.
And then even now, if we're kind of looking at how social media and society is impacting plastic surgery,
Mm-hmm.
there's also been a rise in the number of people who are doing things like Ozempic,
Okay.
right?
Yes.
In the
That's
West and
true.
those places. So you
Yeah.
get massive weight
Hey,
loss.
even here, it's moved here.
Yeah, it's moved here, and we're starting to see it. And then
Yes.
again, now with that massive weight loss, you see, you lose weight also in the face. Okay, so
Mm.
then the face also now
Yeah,
starts
sagging,
sagging, and then you get
etc.
this thing called Ozempic face.
Yeah.
So that's now beginning to play out in our offices because patients are coming with the Ozempic face and they're
Uh-huh.
like, "Listen, I've lost weight. I love the weight that I am, but I look like I'm 80 years old now.
Mm-hmm.
Can you fix my skin?"
That's so
Yeah,
interesting because I know the one thing we know about Ozempic is the weight loss can be a temporary fix because once they're off the medication,
yeah,
it's very easy for them to gain back the weight.
absolutely.
Not that they will, but it's very easy for them to gain back the weight.
Mhm.
So, would you go through doing the surgeries knowing that there's a potential of them getting the weight back, or how do you approach that situation?
So the way I prefer to do it is you you kind of need to create that entire journey for them.
Mm-hmm.
Okay, so if a patient comes into my office and wants, say, a tummy tuck,
Yeah.
okay, one of the questions I usually ask them is if they've already had some significant amount of weight loss,
Mm-hmm.
or they're planning on having the weight loss, because some
Mm.
patients won't tell you until you actually ask them.
Yeah.
And then they'll be like, okay, yeah. I mean, after my tummy tuck, I was planning on doing Ozempic.
Mm-hmm.
And I'd be like, okay, no, let's slow down,
Okay.
right? Because I can't do the tummy tuck and then you go do the Ozempic, because
Mm-hmm.
then the tummy tuck is going to look horrible after about a year from now. So I'm like,
Mm-hmm.
okay, for the next 6 months to 1 year, let's focus on your weight loss.
Okay.
All right, let's get you to your desired weight.
Mm-hmm.
And then once we now have you've achieved the weight that you wanted to achieve,
Mm-hmm.
and you have the framework,
Yeah.
then we can now contour based on that framework.
Okay.
I don't know if that makes
It
sense.
does. It
Yeah.
does. Yeah.
So you have to create what we call a comprehensive treatment plan for the patient, as opposed to just fixating on this particular surgery that they want. You have to understand the entire patient, where they've come from, where they want to go, and all those kind of things,
Yeah.
if you want to achieve really, really good results that last a long time.
This is why you need a certified surgeon, by the way.
Yeah. So there's a lot that goes into it.
Yeah.
Because I'm not a fan of operating on people many times. It means I didn't do it well the first
That's
time.
true.
So
That's true. Yeah.
we don't have to rush into the surgery. We have to
Yeah.
look around all these other things that are going on.
Mm.
Like your weight loss journey. Are you a lactating mother? Are you planning on getting pregnant next year?
Yeah.
All these kind of things.
Oh, okay.
They have
Mm-hmm.
something to contribute.
Yeah.
Yeah.
You mentioned pregnant mothers, and I
Yeah.
just have to. This is just a question, by the way, it's like a segue.
Yeah.
So I always get this question: if I've had a breast implant and I'm lactating,
Yeah.
do my breasts still function as they were supposed to function for a breastfeeding mom, or is part of the tissue that would be used for breastfeeding dead or like taken out during the augmentation?
Okay. So, um, your breast will still work,
Okay.
and they'll still give you milk. Yeah.
Mm,
It pretty much just depends on where. There are different places where you can put the implant.
yeah.
I don't want to get too technical.
Yeah. Yeah.
So if the implant is underneath the muscle, then the breast tissue is fine. You can
Okay.
still
Can
lactate.
still
But if for
function.
whatever reason you violate the breast itself and the ducts within the breast, then you may have some issues.
Okay.
Yeah, but with implants, you're very likely to still be able to breastfeed.
Okay.
Yeah, that said, implants,
Interesting.
like I mentioned, the world is kind of trying to move away from the implants.
Mm,
Yeah,
okay.
so there are more kind of natural options that are slightly better. Don't get me wrong, implants are still very popular,
Yeah.
especially different parts of
And
the
what
world.
implants should people look for? I've seen silicone. I don't know if there are others. So
Yeah, oof, that's a whole
it's
thesis. Silicone, there's saline implants, and then they
yeah,
come in different shapes and sizes and
yeah.
contours and textured, non-textured.
Okay.
It's a whole, it's a whole, it's a whole bunch of stuff.
Yeah, but of
Yeah,
course you go through that process with the patient.
yeah, and also
Okay.
depends again on what's available. The
Okay.
place in the US, you have so many options of implants you can get.
Yeah.
But here we don't have a very vast variety
Mm-hmm.
of options just yet.
Okay.
Yeah.
Then I also got this question. Should is the most expensive surgeon the best surgeon or not? Over to you. Over
You
to
guys
you.
want to get me in trouble, huh?
No, honestly, this is a question that people were asking.
Yeah.
Yeah.
Um, I'll answer it like this. It's not my place to say who is the best surgeon or who isn't the
Okay.
best surgeon. Unfortunately, that's just not the way this profession works.
Yeah, that's true.
What I can tell you is that there are a lot of things that go into the pricing of different procedures. There's, of course,
Before you even get there, let me just
yeah.
plug you. So here's a podcast called The Business of Medicine. And that's why he's the best person to answer this question.
Yeah. So there are a lot of things that go into the pricing.
Yeah.
Um, so there are things like the training.
Mm-hmm.
It costs a lot of money to train a plastic surgeon. And whether you're training in Kenya, whether you've trained abroad, and what kind of training you've undergone are things that people kind of also factor into their pricing.
Okay.
And it's not also just the training that you had done before, it's the training that you consistently go under. So for me, that you're consistently undertaking. Because if I'm trying to give you the best possible outcome and all these kind of things, I have to constantly keep
learning.
updating my skills and this, that, and the other. So that involves a lot of expensive courses, it involves a lot of expensive conferences, this, that, and the other. That all of these things have a role to play. And then there's also just what we call the standard pricing, or what the market accepts as fair pricing for a particular procedure. Okay, so based on all this, for example, the surgeon can charge you differently along that scale.
Yeah.
Okay, so I don't want to say one surgeon is expensive and another one is cheap.
Yeah.
Okay, a surgeon is charging you what they're charging you. How expensive it is a conversation you guys just have with your surgeon. Then there's other things like the facility.
Yes.
Depending on the facility you go to, the pricing is going to vary. Because it may be very expensive to do certain procedures in private hospitals as opposed to doing it in, for example, the plastic surgeon's own clinic or their own center or in a government hospital, for example.
Yeah.
That the pricing also varies. And then there's technology involved also in plastic surgery. Okay, so if we're using one kind of technology for your lipo versus a different kind of technology that gives better results and all these kind of things, then that also gets factored in.
Yeah.
Right? It's like the equipment you're using for this podcast.
Yeah.
Okay.
So a lot
Yeah.
matters.
There's expensive, then there's cheap. And sometimes cheap is expensive.
Yeah.
Right?
That's true.
So yeah, that's probably how I'd answer that question.
Okay.
Yeah.
So actually, now you mentioned something. Where do you guys actually take on your cosmetic surgeries? Because it's not in the public hospitals, it's not in the private hospitals. Where do you?
Yeah, I mean, not To be honest, not a lot of cosmetic surgery happens in public hospitals. Public hospitals exist for different reasons, and they cater to more pressing national needs, as they should. In my opinion, because again, like I said, we're not that many, and probably public facilities focusing too much on the wrong things will take away a lot of resources from the patients who need the more urgent and more impactful care. But yeah, you'll find plastic surgeons in private hospitals, in their own facilities. That's where majority of, I'd say, the cosmetic surgery does happen.
Yeah. So your facilities have a theater and everything necessary for surgery?
Yeah.
Okay.
Yeah.
Okay. Interesting.
You can have everything done pretty much in-house.
Yeah.
And also, back to the thing about the pricing, it's important to not look at the pricing as just one fixed standard figure and fixate on it. It's important to understand what does the pricing entail, and what value is inherent within that pricing. Because a lot of the stuff, so you have to ask yourself, for example, if you're getting lipo and you've been told it's X amount of billions of Kenyan shillings, what is within that package? Is it just the surgery alone? Am I spending one night? Is there massages involved? Is there nursing care? Is there aftercare? Are there vitamin supplements to help my healing? That kind of stuff. Okay. So you need to look at it at what does that thing actually entail. So something may look expensive at first glance, but you may realize it's probably just a one-off cost that I'm going to be incurring for the next 6 months, which then changes the conversation a little bit as to whether it's expensive or not.
I think it's got me thinking about transparency. Hey, the English is refusing. And from a patient's perspective, they might not be able to get that information out of you. So is this something that you break down to them so that they can be aware that this is what the package or you're paying for? Okay.
So I mean, I speak for myself. I don't know how other people do it, but I'm very, very big on the customer experience and how the communication about things is done. Because like you say, if you tell somebody this procedure is X amount of billions of Kenya shillings, and you just tell them that blank figure, they'll be like, oh no, this is too expensive, why am I paying for this, blah blah blah, blah. And you kind of lose them. But you're losing them simply because you haven't communicated well enough. That's true. What that entails. And when you actually sit them down and walk them through it, then they understand. So normally what I do is, after doing a consultation, is my team and I would sit down and put together a whole treatment plan, which tackles everything that we've discussed. So what the problem areas is, what solutions we're providing for this particular area, what the pre-surgery care would look like, the post-surgery care would look like, what things are going to look like 6 down, 1 line. So you kind of have a roadmap, okay? And then with that, we send what's called a cost estimate. So it breaks down the cost. Okay, so you're going to pay this much, and this much entails A, B, C, D, and it's listed there. And then you say, okay, this price excludes this, that, and the other. Okay, so it's so that the communication is very, very clear, and the patients know what they're paying for and what they're getting.
I think that's a really good way to do it. And it's true, customer experience is so important now. And you find that I think doctors don't really understand that you should be aiming to have a patient for life than just a one-time patient. It makes so much more sense. You had talked about non-surgical procedures. Just tell me a bit of what we have available in Kenya. I saw you do it might be hair transplant or not, I don't know, hair something. There's Botox. Like, what do we have available to us?
We have actually a lot, and it's such a very quickly changing field. At the end of the day, a lot of the non-surgical aesthetic stuff revolves around rejuvenations, whether that's the face, whether that's the hair. And the key thing we're talking about here is, if you break it down, it's collagen, it's healing, and it's repair. Okay, we're trying to fight aging. So we do a lot of hair restoration. So you can do hair restoration with these things called platelet-rich plasmas, which stimulate the hair growth. They reduce the thinning, they retard things like the...
Me, am I a candidate? Like, could I benefit from it?
We also have...
You just
hair transplants. And other things like Botox.
Yeah.
There is microneedling. We have a lot of laser treatments, radio frequency. The list is endless.
Now my next question is, a lot of what you've mentioned, or let me say a good amount of what you've mentioned is also done by dermatologists and estheticians. So where do you guys work together, or like where do you draw the line? What's the whole?
This is the second time in 45 minutes you're trying to get me in trouble.
No. Sometimes I'm really for the idea of collaboration. Yeah. And sometimes like maybe you'd prefer to do more of the bigger, maybe the more invasive procedures, and maybe you don't prefer to do like the non-surgical, so you give it to an esthetician or a dermatologist that you're working collaboratively with. Is it something that you can do in Kenya where you work collaboratively, or are they completely different?
Yeah, no, 100%. We can collaborate.
Yeah.
It's just let me put it like this: the aesthetic industry is kind of in a bit of evolution, and that evolution has had good things come out of it, and has also had some things that are not so great come out of it.
Okay.
Because everybody is fighting for a piece of this cake, that is worth a lot of money.
Yeah.
Right. So traditionally, let me say traditionally, but ideally, aesthetic medicine was under the purview of plastic surgeons and to an extent the dermatologists, which as it is today.
Yeah.
But we also still have a lot of medical doctors going straight into aesthetic medicine, which is also great, provided, in my opinion, that they're doctors and it remains a thing for doctors, because it's you need to be very careful with aesthetic medicine. And I say this because I have had patients who kind of come into the clinic and they get their Botox done in the salon.
I'm sorry.
Yeah, like they've gotten their hair braided, and
And it's like, and Botox?
the person doing their hair is like, can we do a little bit of?
Are you
These are true
serious?
stories. It happens, and they come and they get their Botox done, and they leave, and then you come and you find the dosing has been all wrong. They've been injected the wrong areas. They've had complications from the Botox. But you see, people think that it's just kudunga sindano, So in the wrong hands, aesthetic medicine can be dangerous. So we are kind of in a place where it's more of trying to figure out how can we regulate how aesthetic medicine is done and practiced, and can we keep it just for the doctors who have been well trained enough to kind of do it. I think for plastic surgeons, yes, as much as we do like doing the big things, there's also a huge role for us in the non-surgical stuff. Because there are many people who enjoy it, and sometimes you find plastic surgeons
even
who
yourself,
don't
you look like you really enjoy it when you're showing us the videos.
I do.
Yeah.
I do, because the downtimes are less. You can see the results almost immediately. The patients like them. They don't require any anesthesia. They don't also take too much time in the clinic, as opposed to like a 360 lipo that can take 5 hours. You can do your Botox in 15-20 minutes.
Okay.
So there's that as well. Plus also there, like I said, plastic surgeons who may not want to do tummy tucks and all that stuff and just want to focus on aesthetic medicine.
That's true.
I know there are also a lot more dermatologists now going into aesthetic medicine. And then like I mentioned to you, we also have a lot of medical doctors who are now going into aesthetic medicine straight. So it opens up the entire industry for a lot of evolution. Okay. And the more people that we have doing it, the more right people that we have doing it, the better for everyone as a whole.
That's true. Yeah. That's true. But regulation is so important, as you mentioned.
Yeah.
So what's the role of the Kenya Plastics? Remind me the name.
The Kenya Society of Plastic
Kenya
Reconstructive
Society.
and Aesthetic
Yeah.
Surgeons.
Yeah.
It's a mouthful. KISPRAS, that's what it's called in short.
KISPRAS.
KISPRAS. So the role of KISPRAS there is to help the medical council to regulate and to advise on policies and advise on scopes of practices and that kind of thing. Because unfortunately, usually what happens is when things go south, it's the plastic surgeons who
unfortunately you suffer the bad end.
end up being blamed for certain things. So it's in our best interest, in the best interest of the patients and the public, for us to be able to step in and try and assist in the regulation
Okay.
of all these things. But yes, we do work together. But again, working together, you can only work together as much as the next person wants you to work
That's
with them.
true. Yeah, there has to be
And
goodwill.
yeah, and it's like everything. There's always politics. There's tough wars. There are people who don't want to collaborate.
Yeah.
But there are also people who do
That's
want to
true.
collaborate.
That's
So,
true.
and when those opportunities exist, we embrace them and go forward.
Okay, we're almost at the end, but now I saw, I don't know if you know Dr. Fiona. I don't know how to say her last name and I don't want to butcher it. So she had a video on TikTok where she was talking to anyone who's considering cosmetic surgery. What should you do beforehand? So, for instance, when choosing a doctor, choosing a facility, maybe preparing your budget, how would you advise someone who is like looking to get in touch, maybe with a plastic surgeon or to have a procedure done? What should they think about? Yeah.
Okay. So I mean, here we'd be speaking about kind of doing your due diligence.
Okay.
Most patients already, their first point of contact with any plastic surgeon, or at least these days, is on the internet.
Yeah.
It's either through the internet or through a referral. So somebody who's had plastic surgery done, and then they refer a patient to you.
Yeah.
I mean, they refer
They
you
refer you
to
to the
their
doctor.
plastic
Yeah.
surgeon. Referrals are a good way to go, but just because somebody said that this person is a plastic surgeon doesn't necessarily mean that they're a plastic
That
surgeon.
is true.
So even if you're being referred, you still have to kind of do some very good due diligence. So that number one would be finding out whether this person is licensed,
Yeah.
registered by the medical council. You can find out that information from the medical council themselves. You can also, reach out to the Kenya Society of Plastic Reconstructive Aesthetic Surgeons. You can get that information there. You can also ask another plastic surgeon. So,
Okay.
whether this is actually a plastic surgeon, or medical doctors also within the field tend to know
That's true. Like
who is a plastic surgeon and who isn't.
Especially now if you're
So-
saying you're 36.
Yeah.
Yeah.
Yeah. So, speak to your doctor friends. They would tend to know who is a plastic surgeon and whatnot. And then after that, there's also I always say it's very important to feel very comfortable with whoever it is who's doing your procedure. So, go into the consultation. And I always insist that you cannot do the consultations online or, on Instagram or via the
Instagram is not a
DMs.
place for consultations.
Yeah. So a lot of patients tend to want everything
Yeah.
in the messages, and they kind of make their decision based on what that kind of response is like. But when doctors tell you to just book clinic, come in for consultation, it's not a money grab, guys. There's a really good reason why you're advised to come in and sit with your doctor and go through the consultation process.
And let me just add something small. Apart from that, where of course you have to examine them,
Yeah.
we're also like legally, you can't share all that personal information. So that's also a legal issue for us.
Yeah.
Yeah.
Yeah. It's a professional service,
Yeah.
so it needs to feel professional.
Exactly. Yeah. You can't be telling me your whole life history and biodata on DMs.
Yeah.
No.
Yeah, or in the comment section. So
Yeah.
come sit down with your plastic surgeon,
Yeah.
and have a conversation with them. You also kind of get a very good idea or sense of who you're dealing with when you're actually in the consultation. There are unfortunately places that you don't get to meet your doctor until you're on the operating table.
I'm sorry.
Yeah. So again, this is why the consultation bit is important. So make sure you're actually seeing your plastic surgeon and the person who's going to operate on you.
Yeah.
And they should be able or in a position to answer your questions and address your concerns. And they need to discuss certain very important things with you. So like, one, what is the actual plan of what do you think we're going to do? What are the risks? What are the complications? What are the alternatives for your treatment? You need to leave there with a lot of information regarding that. And then there's also the whole process of informed consent.
Yes.
So again, that means that you understanding the procedure you're going to undergo, what the alternatives are, what the risks and benefits of every procedure.
Loud on
is.
that part. What's the
Risks?
Yes. Informed
What the risks
consent
entail.
means you've understood the risks. I feel like people don't understand that part.
Yeah.
Yeah.
I mean, even if you want to take it a step further, every plastic surgeon does have a license. if you really want to go that extent, you can ask them to
Oh,
show
for
your
sure.
license,
Yeah.
or like I said, get in touch with the medical council, or just go on their website and you're able to,
Yeah. It's
see.
actually public information at
It's
this
public
point.
information.
Yeah.
Yeah, it is.
Okay. Okay. Now we're going to the fun part.
Okay.
Oh, wait, were you
Well, this
done?
was not fun.
Oh no, no, okay.
I've bored you guys
No,
to
no, no,
death.
no, 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 no. Where we get to
Thank
see
you.
you
It's
like
okay.
now
Let me
laughing,
leave.
actually laughing. So, what are your most enjoyed or your favorite procedures, and what are the ones you don't enjoy? You're just like, not again.
One, I have a love and hate relationship with a lot of the procedures that we do. I was telling my anesthesiologist last week that I always forget how tormenting some of these procedures are every single time because I have a short memory span. So you go in for, I go in, for example, to do a tummy tuck, and we'll start off, everyone is happy. Then I'll get to the point of the surgery where I'm like, why am I here? And then towards the end, the euphoria comes back. We're done. The patient looks great. This, that,
And
and
just
the
like, that's
other.
my work.
Yeah. So that tends to be me in like majority of the procedures.
Okay.
There's crescendo, decrescendo, and that kind of thing.
Okay.
What surgeries do I like the most?
Or procedures. It could be
Or
like the
procedures?
non-surgical procedures.
I don't know. I draw a lot of joy from the reconstructive procedures. The ones where that's super impactful.
Yeah.
But also there's still the cosmetic ones. I love doing the tummy tucks and the breast lifts and seeing the patient whose expectations and outcomes have aligned. Okay. So I may not even have enjoyed the surgery itself or actually doing it, or sometimes surgery is hard, you guys. Like,
first of all, the fact that you'll stand, me, I don't know. The one thing in life I did not sign up for is standing.
Surgery is hard. So I may not have enjoyed the surgery, but
Yeah.
I enjoyed how the patient has enjoyed the outcome.
Okay.
That for me is the best thing.
Okay.
Yeah, when you see the patient at their last consultation visit and they're happy and they go off never to be seen again.
Yeah.
And then you see them on somewhere like Instagram or on holiday somewhere.
Just
on
like
the
bikini
beach.
body.
Yeah, and you can see their face and you can see how that has impacted them. So those are the small places where I draw a lot of joy from.
That's a diplomatic answer, but we love it. Then just one more question and then the last one. So I keep getting this question. Could you please talk about keloids and granulomatous scars? Yeah.
Okay. Keloids. Keloids are a problem of colored skin.
Oh.
Yeah, primarily.
Okay.
So you tend to see patients like the Caucasians, they don't get much of keloids, if at all. I've never met a Caucasian who's had a keloid. I'm sure they can still get them, but not
it's
great.
not common.
So you tend to see them more in Asians and especially the blacks. I'm saying the blacks like I'm not one of them. in black people, such as myself.
Yeah.
And it's pretty much just a complication of healing. So, and I usually use this analogy to explain it to my patients. It's like, okay, anytime you injure your skin, there's a healing process that's going to happen. So if you consider that injury, for example, a pothole, right? I don't know if you grew up in the days where we had potholes.
We still have them today, my friend.
Not as bad as
hey, there's that road over there called Menelik Road. People just tembea there
yeah,
kidogo.
Menelik Road is horrible.
Yeah.
So the way you fill the pothole with the cement or whatever it is. So that's ideally you're supposed to fill it until it's level.
Yeah.
All right. So ideally the body is supposed to heal until it's level. All right. But sometimes the signals within your immune system to tell the body to stop laying down the cement are not there. So it just keeps piling it on. And eventually you end up with this huge bump.
Yeah.
So that is the easiest way to kind of put what a keloid is. So there's a genetic component to it. And it usually only occurs in places where you have inflammation or damage to the skin or the dermis at some point.
Yeah.
There isn't any cure that's, let me say, 100% effective. Anytime you have a keloid, there's a chance
of
it getting recurring. And what we aim at doing the most is reducing the chances of the risk of that keloid coming back.
Okay.
Yeah, but we still haven't figured out
how do we reduce the chances?
It depends. Okay, so some keloids, most of them, you'd need to remove them surgically.
Yeah.
All right, so that you create a whole new fresh wound.
Mm-hmm.
And then we can do steroid injections. Right?
Oh,
So
okay,
steroid
yeah.
injections retard that process of the constant lay down of the healing material or the healing tissue. And then you can do things like radiotherapy, which also slow down how quickly the cells replicate, the
Okay.
bad cells replicate.
Yeah.
Yeah, those kind of tend to be the mainstays
Okay.
of the treatment. But yeah, it's a terrible problem.
So now for someone who's coming for cosmetic purposes, maybe they don't have a tummy tuck
Yeah.
and they have keloids, is that a candidate for such a major surgery with such a huge scar?
It is, because one of the thing with the keloids is you can never predict when somebody will get one and when they won't get one. All right. So patients who have keloids, you can find some areas they don't have keloids at all, and they've had scars on them, and other places they do.
Okay.
If a patient was to come in, a keloid former wants to come in for a tummy tuck, it's not an absolute contraindication.
Yeah.
Which means, it's not a no.
Yeah.
It's not a hard no for you to not get the procedure done. It's just good to let me know so that we can know how to mitigate
Okay.
the circumstances for it, and also for the patient to understand that, look, you're a keloid former, there's nothing I can do about that. There's a chance that you can get a keloid on your scar. Yeah, but such kind of patients, we put them through those steroids and all those kind of things just to prevent the chances.
So now we reached the tail end of this podcast episode, this very long one that everyone will listen to. I really enjoyed it, but I always give my guests an opportunity to dispel one myth or misconception. Again, it doesn't have to be related to your field, just in health. One that you've always wanted to tell people, guys, that's a myth. It's a myth. There's no scientific evidence around it.
um, do, 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 do. I get a lot of patients who are on a lot of supplements.
Please.
I don't know what your opinion about
Bring
that
the mic closer. Go on.
I'm not here to say that supplements are bad.
Yes.
I just don't think that they are the answer to everything and every solution. There's a lot of stuff that we already get from just our daily balanced diet. And there's a whole world of supplements, and behind that whole world of supplements is a machine that's trying to make a ton of money at your expense. Again, supplements are not bad. If you're taking them, they're not harmful. You can keep taking them, but don't let that distract you from what eating well and
very true,
and exercising. They're not how do I say, you can't trade having a healthy lifestyle for just supplements only. You understand?
That's true. At least I don't sound like a broken record now. But also, maybe they need to understand, maybe we need to understand that supplements are meant to supplement.
Yeah.
So if you don't have a deficiency, it's as good as doing nothing.
Yeah.
Like there's nothing, you'll have excess B12 and now you're better. No, as long as you have the recommended amount of B12, you're okay. But someone who has a deficiency and now they get on the supplements, then they can come back to now the recommended amount, and now the supplements have benefited them.
Yeah.
Okay. Thank you, JP.
You're welcome.
Come again.
Thanks.
I think there's so much to talk about when it comes to plastics. I think now the next time we'll focus more on the curative aspect, because we've dived a lot into the cosmetic side of it, or the aesthetic side of it.
For sure.
So guys, please, first of all, plug yourself. Where can they find you?
Where can they find me?
Yes.
Like today? No, I'm joking. You can find me, I guess, one easy place is Instagram, TikTok. My handle is Rekabisha on Instagram, JP Ogalo on all the other platforms. And from there, you can get a lot more information of how you can reach out to me, how to book a clinic appointment. I am all over the place in Nairobi. I'm not very difficult to find.
We like to hear that.
Yeah, you can also check out my website. That's drjp.surgery. Yeah, and there's a lot more information about who I am, what I am, and where I am as well.
And not today, but another day.
Thank you so much. And if you also get a chance, you can also check out the Nairobi Sculpt Aesthetic Center.
Ooh.
There's some very cool plastic surgeons there. You can find a lot of them there, including myself. Yeah, all board certified.
Okay.
Yeah.
Okay. Hey, before you leave, you've said that, and I just thought. So this is a yay or nay, spas or no spas for aesthetic procedures. To touch you up, we'll touch
This is
you
the
up.
third time in 45 minutes you're trying to get me in trouble.
You don't have to answer the question, but think about it. From the conversation you've had, guys, think about it. So thank you so much. I think we'll end there. And now we can just say bye to the guys. Please like, share, follow, subscribe, comment. I want to engage with you guys. And if you have questions, JP is always here to answer them. Or you can leave them in the comments and I will direct them to him. So that's it for today. Bye. Wave.